For 133 days and counting, nurses countrywide have been on strike. In their absence, childbirth turned into death traps for mothers and their newborns.
We have not been delivering. Without nurses, there is nothing we can do. They are the backbone of the health system.
The human cost of the strike is taking a toll on pregnant mothers and newborns, as unequipped, unskilled birth attendants take the place of the nurses.
The situation is terrible. Let me not hide. It's terrible.
A confidential service data by the Ministry of Health recorded in the District Health Information Systems reveals worrying statistics. Maternal deaths doubled to 857 in the first half of this year compared to the same period last year. Yet this data represents only about 10% of these deaths, as many go unreported, according to ministry officials.
Marsabit is one of the 15 worst counties in the country where mortality rate is very high.
Kenya is right now one of the worst countries to give birth in, with an estimated 20 women dying daily during childbirth. To save their lives and those of the babies they carry, mothers in Moyale are trooping to the neighboring Ethiopia. But only a few will come back happy. Some never return. Others will come back alone. As the sun dipped into the Ethiopian valleys beyond, Dhima Abagutho went into labor. In a village without electricity, no mobile phone network, no vehicle, and now no nurse as well, her cramped little hut in Moyale's Badanrero village became the delivery room.
She removed all everything here, including everything. Everything.
A neighbor helped Abagutho during that high-risk process that doctors fear could turn fatal in such a setting, especially without a skilled birth attendant.
Oh, it's a terrible situation. When somebody is in labor, we expect so many things. When there is an obstructed labor, what do they do? For us, we rush for the cesarean section. What do? So they'll end up leaving the patient to die, the mother to die. We lose both.
Fortunately for Abagutho, it went well. And now a special skin hangs over her doorstep, a sign, according to the Borana culture, that a baby boy has been born. Her neighbor, Habiba Hussein, however, was not lucky. She endured nearly a month-long nightmare, struggling to deliver her baby.
Na vile mnajua hiyo kitu ni uchungu, dakika 5 inaweza letea mtu shida, lakini muda hiyo yote wiki 3 bila daktari alikuwa amekaa hapa. Wamama walikuwa wanajaribu, hawa midwives walikuwa wamejaribu, lakini hawakufua dafu.
The water broke, but for 2 weeks I stayed here.
The biggest facility here, Moyale Sub-County Referral Hospital, has not been operational, just like the dispensary back in her village.
Mpaka alikuwa amebebwa kutoka hapo mpaka hospitali ya Ethiopia, Fulesa.
With a near total shutdown of the public healthcare system in Marsabit County, just like in many other parts of the country, mothers in labor here in Moyale have had to cross the border to seek maternal services in the neighboring Ethiopia at a hospital known as Fulesa, about 2 kilometers away from here. After traveling nearly 130 kilometers on a bumpy road in an uncomfortable, crowded vehicle, Habiba arrived at the Ethiopian hospital unconscious. She had bled profusely.
I was put on a drip and then I was told the baby did not make it.
The situation is really bad. Within this week, Monday, a mother came all the way from Dabel to one of these nursing homes, bleeding terribly with HB of 5.6. She has never attended even one single NT. On referral to just a nearby hospital, Fulesa in Ethiopia, she died on just arrival.
Fortunately, Habiba's life was saved and after 3 weeks in hospital, she was discharged. Her identity card, however, remains withheld in the foreign land until she clears the hospital bill. Now she nurses deep physical and emotional scars after that botched delivery. Yet everything would have turned out so differently had there been a nurse at Badanrero dispensary, situated right at her doorstep.
It pained me that no one could rescue my baby. Had there been a nurse, I wouldn't have suffered so much.
For Safi Ali Kotole, however, there was no time left to travel to Ethiopia. Her family, banking on hope that someone would take pity on her, brought her to the near-dysfunctional Moyale Referral Hospital. Doctors describe her as a mother with a bad obstetric history.
This lady who has been having, who has had around 4 pregnancies. She lost about 4 pregnancies. This is the first one. So that's why I decided at least to call on the nurses who are on strike. Please come and help this mother, at least for her to see her kid. And now there she is with her baby for the first time.
We saw Abdul Halim just hours after he was born.
It's a precious baby, can imagine.
Although the emergency is now over, baby Abdul Halim's life remains in grave danger. Without immunization, he could easily contract infectious diseases that are highly fatal to infants. Back in the village, Hakim has turned a month old, but has never been vaccinated. Alatana Galgalo is a community health worker in Badanrero, but he is not authorized to administer vaccinations.
With the help of the God, it's nice. At the moment, it's very healthy. We don't know what happened tomorrow because there's some airborne diseases in you. Anything can happen.
No child has been vaccinated here since June this year when the nurses' strike began.
Doctors say this is a time bomb. If we have an outbreak of measles or whatever disease in the near future, it will wipe out all those children.
Agreed. As I mentioned, in any event, God forbid if we don't agree on Monday, then we'll advertise those positions and recruit afresh.
But there wasn't an agreement, except that the nurses offered to attend to emergencies.
We can no longer sit back and see people dying. So we have talked to the nurses on humanitarian ground, and at least out of the 52 nurses who are supposed to be on duty in this facility, I can say 20 nurses have reported on duty, they have resumed.
The hospital management claims many more nurses have been streaming back. But until all the nurses, and especially those deployed to facilities in the far-flung villages, resume duty, women will continue to give birth by chance, and children will also survive by chance. Sylvie Chebet, Citizen TV, Moyale, Marsabit County.